As you know better than me, there is a huge demand for clinical services for individuals with progressive aphasia and who have a social disorder and where they're particularly a young onset. And this becomes a major issue. Many of you also know that we're on the cusp of disease-modifying treatments, that we're about to find effective treatments for folks that are able to modify the underlying proteins that accumulate in the brain and that cause these problems. And you also know that there's immense need for biomarkers to help define the nature of the disease during life. This is how we figure out which proteins are accumulating in the brains of individuals and interfering with brain functioning. And in order to be able to figure out who should be getting which medication, we have to be able to make this biological diagnosis during life. So there are major issues that we are confronting. And I'm really excited to be able to say today that we're beginning the Penn FTD Center. This is a center that's dedicated to the care of individuals who have progressive aphasia, who have social disorders, and who have young onset neurodegenerative conditions. This is extraordinarily important because it means we're able to consolidate our focus, our resources on these three major needs. We're able to do this through the extraordinary support of some very generous individuals from the Wincote Foundation and other caring friends. As many of you know, NIH now is having greater and greater difficulty with funding, and to be able to provide this kind of comprehensive funding for this kind of comprehensive site, there just isn't. There aren't funds in the NIH budget. So this is done through the extraordinary generosity of the Wincote Foundation and other caring friends. And our goal is to be able to have an effective treatment for FTD in 10 years. And so I really think that we can do this. I think this is attainable. And with us all working together, I think we'll be able to achieve this goal. So the first event of the Penn FTD Center is this Caregiver Conference. And I want to thank the Wincote Foundation and other special friends who have helped make this possible. There are other supporters who've also helped out with this, and without their help we would not have been able to have this get-together today. And we have the Association for Frontotemporal Degeneration, the Alzheimer's Association of the Delaware Valley, the Amyotrophic Lateral Sclerosis Association, and the Institute on Aging are all generous sponsors of this event. And I'm going to ask individuals from each of these organizations to join us and give you a couple of welcoming words. So first I'd like to introduce Susan Dickinson, who is the Executive Director of the Association for Frontotemporal Degeneration. And Susan has done an outstanding job at being able to move care forward for folks with frontotemporal degeneration. And before that, I do want to thank some special people who've put a huge amount of effort into making this possible. That includes Lauren Massimo, Janet Tomkavage, and Erica Hildenbrand. So, Susan.
Thank you, Dr. Grossman. I want to join him in welcoming all of you here today. I think you're in for a very interesting and exciting day. As he alluded to, it is a tremendously exciting time for FTD research. There's a slide that I like to show. I didn't bring it here today, but it's a graph that shows the number of scientific papers published year by year with the terms either FTD or FTLD in them. And if you total the entire number of papers that were published in the decade of the 1990s, there were 120. Last year alone, calendar year 2011, there were 484. So that's just one measure of, am I doing something, Murray?
No.
Sorry. Okay. That's just one measure of the tremendous explosion we've seen, both on the basic research side and on the clinical research side. Some of the specific things I'm sure you'll be hearing about today, we've now identified all the major pathologies. A few months ago, they identified the final major gene that causes FTD. In the past year, they authored a paper that brought out new diagnostic criteria for behavioral variant FTD. There was published new consensus on the categories of the different language variants of FTD. And we're also working with NIH, just completing the first national database where patients seen at different centers across the country, the same data can be collected in the same way and stored in the same database, and we're very optimistic that this will generate even more research for our patients. Much of this work was conducted right here at Penn. We have tremendous pioneers in the FTD field, and Dr. Grossman, Dr. Jedrziewski, and Dr. Lee. And even more of this work was done feeding on the foundation that they laid as pioneers in this field, and the people that they've trained and then sent out to other centers in the country. So we're all very lucky to be here today for that reason. We're also encouraged by what's happening on the awareness side. Certainly FTD is not yet a common term in society, but we are starting to see more and more mentions in media and popular press. And this is starting to pay off slowly in terms of services that we'll be able to leverage that into services for all of you. We know the Social Security Administration recognizes behavioral variant FTD and the various primary progressive aphasias for the compassionate allowances disability category. We've also been greatly encouraged to start working with a number of care facilities who are starting to recognize that FTD patients are not as small a portion of their clientele as they would have thought. And they also recognize that they might not be doing the best job of caring for our patients. So they're working with us to train their staff, get educated about how our patients might be different than others that they see, and the best ways to manage the problems and the symptoms. So it is a tremendously exciting time. I invite you to meet the AFTD staff throughout breaks, if you will. We're thrilled to have a day like this because most of the time we have to interact with all of you by email or phone. But anybody who's called our helpline has probably talked with Sharon Denny or Matt Sharp. They're both here today. Anybody who's wanted to volunteer or run a fundraiser or make a donation, probably talk to Pam McGonigal or Angie Mayer, and they're here as well. So please stop by and see us. We do have a little raffle going on, and Sharon will award the winners at the end of her talk at about 3:30. So welcome, and I hope you have a wonderful day.
Thank you, Susan. Susan's done just an outstanding job with the AFTD, so we're really so lucky to have them, and it's wonderful to partner with you. Next, I'd like to bring up Claire Day, who's representing the Alzheimer's Association of the Delaware Valley. This is a team sport, working together to care for our loved ones, and Claire plays an important role in all of this. Claire.
Thank you, Dr. Grossman. Good morning, everybody. Good morning. On behalf of the Alzheimer's Association Delaware Valley Chapter, it is my pleasure to welcome you to the 2012 Frontotemporal Degeneration Caregiver Conference. The Alzheimer's Association is once again proud to be here today to share in the quest for knowledge as you navigate the caregiver journey. Many of you have left behind your caregiving role for the day. My hope is that you will use today to recharge your batteries, network with others, care partners, take a moment to learn, take a moment for yourself. I encourage you to take advantage of all the information you'll have at your fingertips today with resources from ourselves, the Alzheimer's Association, in addition to the Association for Frontotemporal Degeneration and the ALS Association can provide you with resources, information, and access to the support when you need it. Whether you're just learning about the diagnosis or struggling to find the right care, our services are here to support you 24/7. We can't underestimate the power that we gain from coming together as a group. Henry Ford said it best, coming together is a beginning, staying together is progress, working together is success. As you fearlessly take on your day-to-day, please know as a community organizations, we are here to help you and your efforts so that you can be successful in your role. Thank you and enjoy your day.
Thanks, Claire. Next, I'd like to introduce Jim Pinciotti, representing the ALS Association of the Delaware Valley. As you will learn during the day, there's an intimate overlap between ALS and FTLD, and so we're really pleased to have Jim here to be able to represent ALS, the ALS Association.
Thank you, Dr. Grossman, and thank you all for being here. It's not always easy to get out and do this kind of thing, but it is so very important to educate ourselves and take a little bit of time of respite, too. ALS is Lou Gehrig's disease. It's maybe not real familiar to everybody, but what's interesting, as Dr. Grossman was saying, is in recent years, it's been determined, it's been realized that there is a cognitive component to many people living with ALS. So this is a very important time for us. You know, we're all blessed to be living in this marketplace in the Philadelphia area. We have Dr. Grossman, we have Dr. Jedrziewski and Dr. Lee, and a lot of other very, very brilliant folks that are working so diligently to make a difference for us, for our loved ones, for the people that we care about. So I congratulate you for taking time out of your schedule to be here today. I hope that everything goes as well as you anticipate. I'm sure that it will. This whole concept that Dr. Grossman put together of collaboration, of collaborating across all these different diseases, these different disciplines, is so vitally important. No one of us can do it alone. So thank you, Dr. Grossman. Thank you all for being here. Have a great day.
So next I'd like to introduce Kathy Jedrziewski, who represents the Institute on Aging at the University of Pennsylvania. So Kathy, I'd like to have you say a couple of welcoming words as well.
Good morning. I just want to say the Institute on Aging here at Penn is delighted to be part of this program and one of the sponsors for it. We think it's so important. The Institute, as Murray said, is an institute without walls here at the University of Pennsylvania, and our mission is to work across the School of Medicine, the School of Nursing, and all of Penn's campus to really increase the research and the educational programs in aging. So we're delighted to support this program today, and I hope you all have a wonderful day. Thank you.